2013 was a special year for Kenya Red Cross. It was a year where we saw lots of hope and lots of good work being done by Kenya Red Cross Society. We've been able to be fast responders in most of our emergencies that happen in this country. At the same time, we've also stayed the course and being one of those who would be the last one out in terms of our programs, in terms of our activities. And I can enumerate a number of them in our food security programs, in our health programs, in our water programs, and in basically working with communities, with the local branches, with our volunteers, and with our staff. But I mean, for me, the staggering numbers of having reached close to 12 million Kenyans is something that is beyond one's wildest imagination or expectation. And I'm happy that every year the numbers keep on increasing.
As Kenya welcomed the year 2013, the country was in a state of political uncertainty, and the mood was tense based on the experiences of the 2007-2008 post-election violence. Kenya Red Cross remained focused on election preparedness while advocating for peace through the Chagua Amani campaign. The elections were largely conducted peacefully, with the KRCS teams on standby countrywide. In line with the KRCS constitution, elections were held of new board members at branch, regional and national level. A new National Executive Committee was elected, ushering in a new Governor Dr. Mohamud Said with the retirement of Governor Paul Birech, who was at the helm for the last 2 terms, during which KRCS also experienced exponential growth.
2013 has been a tough year for us, as we all know that there was a national elections which we prepared for us, and we did have some disasters over the year. With the Kenya Red Cross came, and we managed to assist according to our mandate and our mission, and I'm very happy that we have been very successful. As the country elections were done and the new constitution has come in place, we are also trying to align ourselves with the county system. So we have already put in place county committees, and I'm very happy to inform you all that we have trained our board members starting from the branch level, regional level, up to the national level, and I'm very happy that we are ready to perform even better.
Subsequently, the KRCS leadership bestowed the newly elected head of state, His Excellency Uhuru Kenyatta, as its patron. Membership and volunteer management is at the heart of the organization. In 2013, a total of 23,143 members were recruited. 567 youth were elected into leadership position, and an elaborate award scheme initiated for volunteers in recognition and appreciation of the roles they play in service to humanity. A total of 80 individuals, 26 learning institutions, and 12 corporates were awarded countrywide, the climax being the national awards. At the beginning of the year, the Disaster Operation Department laid emphasis on capacity building of employees and volunteers, prepositioning of its disaster response stock and logistics, and strengthening partnerships for effective response. The Emergency Operations Center received and responded to over 10,000 calls with a large number of traffic crashes, fires, floods, and the emerging terrorist attacks and conflicts around the country. These operations were a joint effort between the Emergency Operations Center, E-Plus Ambulance, and support from staff and volunteers, reaching over 1 million beneficiaries.
Many lives have been saved, and the fact that E-Plus is out there today, it is becoming a phenomenon, and I really want to commend the leadership and the management of E-Plus.
During the Westgate attack, the KRCS capacities were severely tested as response teams were mobilized into action within minutes. KRCS also provided psychological support, blood drives, and restoration of family links. Under the We Are One initiative, there was overwhelming financial and in-kind donations from the government, general public, and corporates.
We are the first people to drop down their call for ambulance to come and rescue those who are injured. So the first person I met was a Red Cross driver whom I told, let's go up there.
Despite bullets flying around, they went up that ramp to the parking lot and rescued lives. Many would have died, many more would have died if it were not for the Red Cross.
I was thrown a grenade on my legs, both of my legs, and I found myself lying down. I was taken by the stretchers to the Red Cross ambulance. I underwent the first surgery to remove the shrapnels on my legs. Thanks so much for the Red Cross team for helping me from the incident up to date, because they have been taking care of my bills through Aga Khan Hospital, and they really called me to support me, to give me the heart and giving me the strength to tell me that I'll walk again.
Within 6 days, over 17,000 pints of blood were collected, breaking the National Blood Donor Program record. In 2013, KRCS reached close to 3.9 million beneficiaries in areas of disaster risk reduction and climate change adaptation, food security and livelihoods, road safety campaigns, health and social services, nutrition, water and sanitation. In the face of the increasingly complex emergencies in Kenya and within the region, KRCS has set up the International Center for Humanitarian Affairs to increase the effectiveness of humanitarian action through training, research and publications, as well as policy and advocacy. Informed by the linkage of theory to practice for effective service delivery, the training component is structured for capacity building and skills development. The unit provides training in emergency medical training, disaster management, project management, health emergencies in large populations, and short courses in first aid and fire safety. The Global Fund Program Management Unit, through its 47 sub-recipients, trained over 3,400 community health workers in 26 counties, who in turn provide care and support to over 58,000 people who live with HIV. With 9 wellness centers countrywide and the introduction of a mobile wellness clinic for hard-to-reach populations and places, the program is a major contributor to the prevention of mother-to-child transmission. In 2013, there was marked improvement in the referral of pregnant women to health facilities, with over 20,000 confirmed deliveries from 697 in 2012. As part of the Global Fund Sustainability Strategy, the unit has aligned its own strategies with the devolved county health sector as well as with the national government. In refugees operation, KRCS continued working with partners to offer long-term humanitarian services to the refugee communities in Dadaab and Kakuma.
With all our support, we could have more facilities, and we could have everybody from everywhere being referred to this very, very important and historical hospital.
It's easy to build, so I think the challenge is on you to safeguard these facilities. More importantly, it's about training those brothers and sisters from across the border who have been here, the community health workers, and all other skills that have been here. What he said of starting even a training school for the refugees as when they go back, so they can go back with skills and with certificates, so they can integrate in their society, in their country much better.
Tuko na medical team, tutakuwa na relief, utaangalia zile nyumba zimechomwa na namna ya kuwasaidia wazee na kina mama, lakini tafadhalini tunawaomba amani iwe ni mwanzo na mwisho.
Building on the sustainability pillar for the society, the Boma Hotel continued to position itself as a place of luxury with a conscience. Growth of the Boma chain of hotels saw the opening of Boma Inn Eldoret in June 2013. In line with our humanitarian work, in 2013 the Boma Inn provided a venue of choice for the negotiation and signing of historical peace agreements such as the Mandera and Marsabit.
...2013 for me was another very successful year for Kenya Red Cross, for its staff, for its volunteers, for its membership, for its leadership, and again making a difference in the lives of millions of Kenyans. And this is what I think we're here for, and I look forward to look at 2014 and hoping that there will be not that many disasters, but also want to assure Kenyans that Kenya Red Cross will always be there as a friend, first in, last out.
Thank you, Red Cross and partners.
Is gone when people's lives are shattered and they've lost the will to go on. We reach out to the helpless, and with each passing day, we help them to rebuild their lives. This is the Red Cross way. On to the future. We are one and we stand together when it seems all hope is gone. When people's lives are shattered and they've lost the will to go on, we reach out to the helpless, and with each passing day, we help them to rebuild their lives. This is the Red Cross way. On to the future. We are one and we stand together when it seems all hope is gone. When people's lives are shattered and they've lost the will to